right, folks, we are back here on WLTH 1370 AM. I am Scott Cannon. Over there is Reverend Delwyn Campbell. We are back after rocking out some Herbie Hancock old school jazz stuff. All my jazz heads out there. But back to the grind. Rev, COVID-19, man. This pandemic has been a real bummer in a lot of ways. The pandemic has really pushed a lot of our communities, our social services, our governments to the brink. And some more studies have come out this week that have basically shown the extent that COVID-19 has affected us all. This is from the Associated Press. 2021 was the deadliest year in American history, and new data and research are offering more insight to just how bad it got. The main reason for the increase in deaths, obviously COVID-19, said Robert Anderson, who oversees the CDC, their statistics work. The agency this month quietly updated its provisional death tally. It showed that there were 3.465 million deaths last year, or about 80,000 more than 2020's record-setting total. So 2020 was already the deadliest year in American history. 2021 was even deadlier. Early last year, some experts were optimistic that 2021 would not be as bad as the first year of the pandemic because of the effective COVID-19 vaccines that had finally become available. COVID-19 deaths rose in 2021 to more than 415, up from 415,000, up from 351,000 the year before, as new coronavirus variants emerged and an unexpectedly large amount of Americans refused to get vaccinated or were hesitant to wear masks, experts said. Now, I have to tell you people out there, I can't within good conscience not tell you about other studies that have shown that about 300,000 of the deaths that we have suffered from COVID-19 could have been prevented if we had universal health care in the United States, and have cited that specifically as the reason that the United States had such a disparity in the amount of deaths from other first world countries. Because other first world countries did not have the type of totals that we do. Now, I will say that there are a lot of people who did refuse to wear masks. Okay, that is true. And there are a lot of us who chose not to get vaccinated. I personally did not believe in mandates. I believe it should be your choice in a free society whether you want to put an experimental vaccine in your body. And that was my choice. As a younger person, especially somebody who's under 40. But yes, a confluence of those things came together, but it's important to say that America's lack of health care had something to do with it. But let's get back to the study. The coronavirus is not solely to blame. Preliminary CDC data also shows the crude death rate for cancer rose slightly. And rates continue to increase for diabetes, chronic liver disease, and strokes. So it's not just COVID-19, folks, that has been taking people out the last year, 2021. A lot of things have sort of cascaded down on all of us, including diabetes, cancer, and liver disease. I think a lot of people were not able to go see their doctors, especially early on in the pandemic, or were afraid to go see their doctors early on in the pandemic, and that led to a lot of their deaths because a lot of people were just holding on or barely holding on, and, you know, going to the doctor or, you know, not going to the doctor might be the difference between life and death for a lot of those people. Drug overdose deaths also continue to rise. Now, the CDC does not yet have a tally for 2021 overdose deaths because it could take weeks of lab work and investigation to identify them. But provisional data through October suggests that the nation is on track to see at least 105,000 overdose deaths, up from 93,000 in 2020. New research Tuesday showed a particularly large jump in overdose deaths among the 14 through 18-year-olds. Wow. That's high schoolers. A large jump in overdose deaths among high school age children, folks. That is really disheartening and really shocking. Adolescent overdose deaths counts were fairly consistent for the most part for the last decade, around 500 a year, according to a paper published by the Journal of American Medical Association. They almost doubled in 1 year in 2020 to 954, and researchers estimated that total hit nearly 1,150 last year. Insane. Now, for the last decade, let me reiterate, 500 overdose deaths a year amongst high school age children, around 500, and then about 1,150 last year. So that's over double the amount you've gone in 2 years. You've doubled the sort of mean level of overdose deaths for high school age children. Now, those teen overdose deaths were only about 1% of the U.S. total, but adolescents experienced a greater relative increase than the overall population, even though studies suggest that drug use amongst teens is down. Now, experts attributed the spike to fentanyl. We see this again, fentanyl. This is what took Prince out. This is what took Tom Petty out. This is what took my man Shock G from Digital Underground out. I think DMX too, if I'm not mistaken. Now, fentanyl is a highly lethal drug that has been cut into heroin for several years. More recently, it's also been pressed into counterfeit pills resembling prescription drugs that teens sometimes abuse. The total of U.S. deaths often increase year to year as the U.S. population grows, but 2020 and 2021 have seen extraordinary jumps in death numbers and rates due to the pandemic. Wow. So it just goes to show you, folks, that a pandemic is not just a pandemic. You know, it's not just about catching a virus and getting sick from the virus and possibly dying from the virus. It's all the cascading effects that happen in a society that has something that traumatic happen to it. It's people not being able to go to their doctor and then dying of cancer or liver disease. It's people being depressed and sitting at home, isolated, drinking more, getting cirrhosis of the liver, taking more drugs, you know, that have now been cut with this very lethal medication, fentanyl. Fentanyl is, I just saw probably about 6 months ago, there was a Hollywood party with a bunch of comedians, and all of them like overdosed. There was like 10 people overdosed, and there was this one female comedian who barely survived. She overdosed, but she survived, and there was a young black man who was a comedian who ended up dying from it. It was a very big story at the time, but yes, fentanyl is a drug that is really swept through in the last few years and taken out a lot of people quickly. It is very lethal. It is very potent. Watch out for it, folks. You know, if you're taking pills, if you're taking drugs, they make test kits for these types of things. Now, I don't use drugs. I don't drink alcohol. I don't pollute my body with those things. But for those who do, be on the lookout for fentanyl. Like I said, there are test kits that can be used to examine how much of whatever of it is in your particular libation or whatever, and just be careful. Life expectancy, because of this, life expectancy in the United States fell by nearly 2 years to about 77 years amid the COVID-19 pandemic, the sharpest drop compared to 21 other high-income countries, according to a global study. So life expectancy dropped here, but not in most of the rich countries in the world. Now, why is that? Americans on average are now expected to live for 77 years, down from 79 years in 2019, according to the study, which looked at the national death and population counts in 2019 and 2020 to calculate the mortality rate ratio. The decline in almost 2 years in life expectancy for 2020 was far higher than the mean reduction of 0.58. So life expectancy declined by 2 years in America since 2020, but the mean reduction is of about a half a year in 21 peer countries, including Canada, France, Germany, Denmark, and South Korea. No country experienced a decrease as steep as that of the United States, according to the study. U.S. COVID mortality and excess deaths were among the highest in the entire world, and the virus was the third leading cause of death in the United States after heart disease and cancer. Authors of the study said that the United States mismanaged the federal, state, and local responses to the COVID-19 pandemic at the start. Now, we talked about that here on the show. I remember going back to the early days of this show when it was just me and Levita Sparks Wade. Listen to her every Thursday. She was just on last night. Good show last night with her and Mr. Johnny Rucker. But also Johnny Rucker and Kathy Kelly. I remember when the pandemic first started, and we were talking about here on this show just how incompetent the Trump administration was in their handling of the pandemic way back at the start of the pandemic. And now this study, this global study, has shown that a lot of it has taken its toll on the U.S. population and has caused a 2-year reduction in health, in life expectancy in the American people. Now, Americans die at higher rates because of heart disease, diabetes, and other conditions. The lack of universal health care, income and educational inequality, and less healthy physical and social environments also contributed. Okay? Now, I know the last hour, well, I guess it would be the hour before last, we just had a Republican in here to talk about fiscal responsibility. Okay? Now they always talk about fiscal responsibility when it comes to things like health care and education, but they're never talking about fiscal responsibility when it comes time to funnel $800 billion worth of weapons to Ukrainian Nazis or something. Okay? They never talk about, the $800 billion military budget in this country, the military-industrial complex. Now, this study shows you and has specifically called out the lack of universal health care, income, and educational inequality, and the less healthy physical and social environments of the United States. This is what we get when we have a society, folks, a country that has become a playground for the rich, for the wealthy to do what they want, while the rest of us die. Please give us a call, 219-885-1371, folks. I'll be right back after these messages here on WLTH 1370 AM. That number is 219-885-1371. That number again, 219-885-1371.
You are listening to Cannon Rev on WLTH 1370 AM. Give us a call, 219-885-1371.